This hour, the CDC expected to issue guidance allowing fully vaccinated people to ditch masks indoors in many situations. And the CDC will now recommend that fully vaccinated individuals don't need to wear face coverings in crowds outside either. Now, this is a change from their guidance just a few weeks ago, and we are standing by to hear what the White House will say a short time from now. Again, the CDC plans to issue guidance allowing the fully vaccinated to ditch masks indoors in all but most crowded situations, and they don't need to wear those masks outdoors either. And a good morning to you. Thanks for joining us for our midday newscast. I'm Marcus Washington. Well, that big news coming from the CDC and the White House COVID response team is expected to make that announcement any minute now. We're going to bring you that special report when it happens. Meanwhile, COVID vaccines are now available for kids 12 and up in Bay Area counties. They are ready not just to book those appointments, but they were ready to give out those shots the same day the Pfizer vaccine was authorized for use in that younger group. NBC Bay Area's Chris Sanchez joining us live from Levi Stadium. This is where those tweens can now get those shots as well. Chris?
Hi there, Marcus. I checked the county website, and as of just a few minutes ago, there were vaccine appointments available for kids 12 and up and everybody else here at Levi Stadium. And I did a very informal Twitter poll, and the majority of parents say they are ready to do it right now. Santa Clara County will vaccinate kids 12 and up at mass vaccination sites like this one, but also at community-based mobile sites. The county is also working with pediatricians to get them ready to vaccinate their patients, which some parents have said would make them feel more comfortable about getting their kids that shot. Contra Costa County is inviting parents to show up at walk-up clinics, but they're also accepting appointments as well. Additionally, on May 18th, they will offer the Pfizer vaccine at a handful of school sites as well. Marin is vaccinating the younger kids starting today with the goal of reaching half of the county's 14,000 kids, 12 to 15, within the next week. In Napa County, St. Helena Hospital is also offering the vaccine today, starting today. San Francisco started booking appointments at 8 o'clock this morning. The city's health department held a virtual town hall for parents with questions, and the doctors on the panel were mothers themselves.
I just want to clarify, the emergency use authorization does involve a really careful attention to safety. And so it does not mean that there was corners cut or we didn't look at things.
It is a way for them to protect themselves for their own health, and we anticipate it will decrease cases in schools even further.
Our parents can also book appointments for their kids 12 and up through the state website, that is myturn.ca.gov, and children can get vaccines at their local pharmacies, as some kids are doing today. We know that they're starting to take appointments as well. But this is all moving pretty quickly. If you have questions for your doctor, reach out to them. They might make you feel a little bit better about whether or not to book that vaccine. But I have to run now, Marcus, because I'm due inside at 11:30 to get my second shot here at Levi Stadium. Chris Sanchez, NBC Bay Area News.
All right, congratulations, Chris. Well, of course, we have you covered when it comes to all things vaccine and COVID-19. So just head over to NBCBayArea.com for the very latest information, including where and how to sign up for your vaccine. Our other breaking story, a fire burns a Contra Costa County church building this morning. Those flames shooting out of that building. Take a look at there. And that smoke could be seen for miles. Dozens of firefighters called to battle these flames that left behind a lot of damage. And we've been updating you on this fire all morning long as soon as we found out about it. NBC Bay Area's Bob Riddell, he's live there at the scene. He's been there for some hours now. Bob, so what's the happenings now?
Well, right now, the Contra Costa County Fire Department's investigating what started this early morning fire behind me. We're at the Christ Community Church in Concord. You can still see they have a ladder truck here dumping water on the fire. We haven't seen smoke or flame coming out of there for quite some time. We assume they're just trying to put out what other hot spots might be in there. The pastor tells us there are smaller Korean and Indonesian congregations who also worship here, but she said she's received no threats against them or other members of her church. So again, the cause under investigation. This is what the fire looked like shortly after it started around 5:30 this morning. This was in an attached two-story multi-purpose building used for storage and small receptions and gatherings. Firefighters initially entered, but then they had to pull out because the flames and smoke became too intense. They were able to save the single-story building next door, and the church itself, the worship center, that is fine, but this two-story building is gone. Now, coincidentally, the church is in contract to sell this property, all the buildings, in about a month to a developer who's going to take down all the buildings to make room for new low-income housing. So luckily, most, if not all, the church's historical records and artifacts had already been removed from that two-story building in preparation for that move. The pastor speculated on what she thinks might have caused this fire.
It's the oldest part of our building, so wiring could be a possibility. It's also the part of our building where we've had the most break-ins, usually by people who don't have housing and are looking to sleep somewhere quiet for a little while, or try to use the bathroom or something like that. Because it is the oldest part, it's easier to jimmy open those windows than it is in the other parts of the property.
Again, the fire department says it's too early to say what caused this fire. Incidentally, this building was called the Jones Building, was initially located off Oak Street in Concord, moved here in the late 1940s to serve as the original church before becoming this multi-purpose center. The church's concern now is how to keep that structure safe until the sale of the property goes through in about a month. Then all this will be knocked down again to make a way for low-income housing. Reporting live here in Concord, Bob Riddell, NBC Bay Area News.
They're glad they were able to save those records in there. All right, Bob, thank you. New details in that 12-year-old girl killed in an apparent shooting in Antioch. This happened last night at a home along Oak Haven Way. This is near the Black Diamond Mines Regional Preserve. Now, this is video from the scene from the Citizens app. Officers say that victim was found with a gunshot wound in the home. That investigation into what happened is now underway. And we are already looking forward to the weekend. A live look at Fremont right now, where you can see clouds are somewhat clear for us this midday. And the weather is looking cooler out there. Meteorologist Carrie Hall is here with that forecast for us. Carrie?
Yeah, it's been nice to have the cool down. We started out this morning with some low clouds and fog over parts of the South Bay, our typical stratus that we see, but all of that has cleared out, and we're going to see a lot of sunshine. We're only right now at 61 degrees, but mid-70s for today. These temperatures are much warmer. In fact, there will be a
Biden says the shutdown pipeline is back up and running. Right now, we want to go to President Biden. He's expected to speak on the new CDC guidelines. Let's take a listen.
This is an NBC News special report. Here's Lester Holt. Good day, everyone. We're coming on the air for an important briefing from the White House's COVID-19 response team. The CDC expected to announce a major change in COVID guidelines that will allow fully vaccinated people to stop wearing masks indoors in most instances. It comes as more Americans are vaccinated and the rate of infection is slowing. We want to join now that briefing in progress.
It's beginning to take hold. Case counts, hospitalizations, deaths, virtually every metric is now improving consistently and in most of the country. Today, COVID-19 deaths are at the lowest point since April of 2020. Dr. Fauci has reviewed study after study on these calls, demonstrating the real-world impact of vaccines in driving these results. Recent progress has been especially strong. Since everyone 16 and over became eligible for vaccination, cases have dropped by 45%. And since everyone became eligible 3 weeks ago, that is everyone 16 and over, a full 12% of adults have become newly vaccinated. In a wartime effort, we must begin to press harder when we have an advantage and not let up. Yesterday, individuals 12 through 15 years old became eligible for the Pfizer vaccine. We are putting every resource possible to bear and leveraging every possible partnership in the country to reach people who aren't vaccinated yet and to make it as easy as possible for them to get a shot. More than 20,000 local pharmacies in communities across the nation are now offering walk-in vaccinations. You can text your zip code to 438-829 to get 3 locations near you with vaccines in stock. Soon, you'll even be able to book a free ride through that text from Uber and Lyft. As the president announced, Lyft and Uber are offering free rides to anyone who wants to get vaccinated between May 24th and July 4th. If you want to sort by the specific vaccines, millions of McDonald's cups tell you where to go to, vaccines.gov. Efforts around the country are not letting up, and they cannot let up. They must accelerate with everyone contributing what they have to the effort. Let me close and hand it off to Dr. Walensky by reiterating some of the words the president said yesterday. On July 4th, let's celebrate our independence as a nation and our independence of the virus. 70% of adults with at least one shot by July 4th is a critical goal. When you're winning, you press harder. We can do this. But if you haven't gotten vaccinated yet, now is the time. And with that, over to Dr. Walensky for an important update and what our progress means for Americans.
Thank you, Andy. Good afternoon. I'm pleased to be back with you today. Let's begin with an overview of the data. Yesterday, CDC reported more than 34,200 new cases of COVID-19. Our 7-day average is about 36,800 cases per day. This represents yet another decrease of about 23% from our prior 7-day average. And every day, with daily cases continuing to fall, we remain encouraged by these positive trends. The 7-day average of hospital admissions is 4,100. Again, another terrific sign with another back-to-back decrease of 12% from the previous 7-day period. And 7-day average daily deaths have also declined to 587 per day. Today, I have several exciting announcements to share with you. First, since becoming CDC director, I have seen firsthand the current frail state of the public health infrastructure in this country. I'm committed to upgrading the public health system so the nation is ready for whatever comes next. With this in mind, today we are announcing the upcoming release of $7.4 billion in funding from the American Rescue Plan to hire, train, and support public health workers across the country, reflective of the diversity within the communities they serve. Over half of the money being released, $4.4 billion, will support states and localities, creating tens of thousands of new jobs in communities across America, expanding our overstretched public health departments with new hires to support their COVID-19 efforts. And $3 billion will be focused on preparing these same jurisdictions for future pandemics and to build a public health workforce for the future. Though many threats have increased in complexity and scale in recent years, our nation's public health workforce has gotten smaller. This support will immediately add more staff in health departments across the country. It will add school nurses to K-12 schools to support safe reopening and operations and support vaccinations as vaccines are authorized for younger people. It will expand the number of CDC Epidemic Intelligence Service officers, our elite disease detectives, to respond to local outbreaks and help curb the pandemic. It will expand public health career paths, recruit and train a diverse group of future public health leaders, and launch a public health AmeriCorps to recruit a strong, diverse, and highly skilled workforce that is ready to respond. And it will create new programs intended to increase staffing at our nation's laboratories and build preparedness for the future. We are really excited about what this support will mean for our nation's public health capability now and into the future. Second, last night I endorsed the recommendations of CDC's Advisory Committee on Immunization Practices, making the Pfizer vaccine available to anyone who is 12 years and older. I want to thank the ACIP for reviewing the science and providing their recommendations on the safety and efficacy of the vaccines in adolescents. This is an important step forward in our efforts to vaccinate as many people as possible and to stop the pandemic. And finally, I want to provide you an update regarding CDC's guidance for fully vaccinated people. Over the course of the pandemic, we are continuously gathering data and evidence to inform our guidance and decision-making. We now have numerous reports in the literature that demonstrate the safety and real-world effectiveness of the authorized vaccines. On this slide, there are 3 recently published studies, one from Israel published in the Journal of the American Medical Association, or JAMA, on the top, and 2 from the United States, both published in CDC's Morbidity and Mortality Weekly Report, which all show that COVID-19 vaccines work. In Israel, there was a demonstrated 97% vaccine effectiveness against symptomatic and 86% effectiveness against asymptomatic infection in over 5,000 healthcare workers. In the United States, vaccines were 90% effective against any infection in nearly 4,000 healthcare workers and 94% effective against hospitalizations from COVID-19 in an evaluation across 24 hospitals in 14 states. Additionally, we are accumulating data that our authorized vaccines are effective against the variants that are circulating in this country. On this slide, you can see a study published just last week that demonstrates how effective the Pfizer vaccine is against the common circulating variants in the United States, B.1.1.7, as well as other variants like B.1.351. Additional studies confirm that the Moderna and Johnson & Johnson vaccines are also effective against circulating variants. Finally, we know that in the rare event that people get infected after a vaccine, the resulting infection is more likely to have a lower viral load, be shorter in duration, and likely less risky of transmission to others. Considering all of these factors, the data on vaccine effectiveness, the science on their ability to protect against circulating variants, and our growing understanding of the low risk of transmission to others, combined with universal access to vaccines for those 12 and older, today, CDC is updating our guidance for fully vaccinated people. Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing. If you are fully vaccinated, you can start doing the things that you had stopped doing because of the pandemic. We have all longed for this moment when we can get back to some sense of normalcy. Based on the continuing downward trajectory of cases, the scientific data on the performance of our vaccines, and our understanding of how the virus spreads, that moment has come for those who are fully vaccinated. Now, if you are immune compromised, you will most definitely want to talk to your doctor before giving up your mask. Also, locations such as healthcare facilities will continue to follow their specific infection control recommendations. And lastly, this past year has shown us that this virus can be unpredictable. So if things get worse, there is always a chance we may need to make change to these recommendations. But we know that the more people are vaccinated, the less cases we will have and the less chance of a new spike or additional variants emerging. If you develop symptoms, you should put your mask back on and get tested right away. The science is also very clear about unvaccinated people. You remain at risk of mild or severe illness, of death, or of spreading the disease to others. You should still mask and you should get vaccinated right away. This is an exciting and powerful moment. It could only happen because of the work of so many who made sure we had the rapid administration of 3 safe and effective vaccines. It could also only happen because we have an adequate supply of those vaccines for everyone 12 years and older in this country. Your health and how soon you return to normal life before the pandemic are in your very capable hands. If you are not yet vaccinated, please go to vaccines.gov or text your zip code to GetVax, that is 438-829, to find a vaccine in your area. Once you are fully vaccinated, 2 weeks after your last dose, you can shed your mask. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. So Dr. Walensky has spoken to you about the exciting issues that we can now look forward to when you have vaccination. I'm going to talk to you a little bit about the future of where we want to go with vaccines with regard to coronaviruses, and that is the development of a universal coronavirus vaccine. If I could have the first slide. This is something that has been discussed now for some time. These 2 articles, one in the lay press in the New York Times from Carl Zimmer, asking about the possibility of a universal coronavirus, and the other in Science magazine by John Cohen. So what would we mean by universal coronavirus? Next slide. This is the phylogenetic tree of the coronaviruses. The ones in red font are human coronaviruses, and the 4 that have yellow highlighting are the 4 viruses that account for anywhere from 5 to 15% of the common cold.
Dr. Fauci now getting into detail about the effectiveness of vaccines, but the major headline made by CDC Director Dr. Rachel Walensky a moment ago, her words, "We can start doing the things we stopped doing," referencing people who have been fully vaccinated, meaning have gone 2 weeks past the last scheduled vaccination, and basically not have to wear masks in virtually any setting. Let me go to NBC News senior medical correspondent Dr. John Torres. Dr. John, this is a stunning announcement. It was only a few weeks ago we were hearing about wearing masks outside. What's your takeaway of the shift that allowed them to make this announcement?
And Lester, you're right. This is a stunning announcement, and I think it caught a lot of us by off guard to a certain extent because we knew this was coming with the science, but we didn't know it was coming quite so soon. And I think part of this is they're responding to the science. They're responding to other public health experts saying, you know, wait a minute, we know that outdoors, particularly if you're vaccinated, more importantly, then you don't spread the virus. And they brought up a couple of good points, or Dr. Walensky did. She said, number one, we want to make sure that you understand these vaccines are effective, and they're particularly effective against the variants as well. And that's something we're now finding out. Plus, one important point she put in there is we also know now that the transmission rate, if you're fully vaccinated, the risk is very low, and that's an important part to taking the masks off. And so she said essentially that they want to make sure that people understand that because the vaccine rates are high, that's why we're able to take these masks off. At the same time, she did specifically say for certain people, immunocompromised people, people who are unvaccinated, then it could be a different story. Particularly unvaccinated people, they need to keep wearing the masks. And if you get sick and have symptoms, you need to put your mask back on. And also warned us to a certain extent what we're seeing in other parts of the world, that if cases start to go up, then we might need to put masks back on. But this is good news, Lester, because we're finally starting to see sort of essentially the rewards behind our efforts. And that's what one thing that Dr. Slavik or Andy Slavik was saying, that we put a lot of effort into this. It's time to start seeing the rewards from this. And I think that's what we're seeing at this point, Lester.
Yeah, another headline from here. We don't want to ignore this. She also said that unvaccinated people remain at risk of illness, death,